want to thank you for the opportunity to meet with you today and to talk about the automated office blood pressure measurements. I'm going to take just a few minutes to share with you why we think this is so important and why I'm delighted you're here today, because I think this offers our patients an opportunity to get a more accurate blood pressure, more representative blood pressure, and I think help them get more appropriate treatment, not to get so much risk of over-treatment or under-treatment. And so this device, if we use it according to a certain protocol, helps us to do that. So let me just take a moment and walk through some things with you. I'd like to keep this informal, so if you see things that raise questions, just please raise your hand. We'll stop there and take care of it. Because if you have a question, as you know, probably other people have questions also. So just to review quickly why blood pressure is important. And high blood pressure contributes to lots of problems, as you know. About a third of adults in the United States have high blood pressure. 40% of African Americans, about 28% of whites and Hispanics. So African Americans are 40% more likely to have high blood pressure. High blood pressure increases from about 10% at age 30 to 60% plus at age 60. So it's very strongly related to age. Nearly 70% of heart attacks occur in people that have had high blood pressure. And that's coronary heart disease, MI, think of those as the same. You've got problems with the arteries to your heart that's causing heart problems. Heart failure, nearly 3 out of 4 people. In some studies, as many as 9 out of 10 people with heart failure have had high blood pressure contributing to that heart failure. It contributes to over 300,000 deaths, and disproportionately, as I'm sure you know, in African Americans. In the Charleston Heart Study, 45% of deaths in African Americans were attributable to high blood pressure, versus less than 1 in 4, less than 25% in whites. So a major health disparity related to blood pressure. Over 500,000 hospitalizations and more than 55 million medical visits for high blood pressure. One of the most common problems we see. I don't need to tell you that. You're seeing it every day, morning and afternoon. And then it contributes a lot to healthcare costs. Obviously, billions and billions of dollars contribute to healthcare costs. Let me just move into this. Why we think blood pressure measurement is so important. Oftentimes, we don't have blood pressure standardized in an office, much less across offices. So sometimes we're using different instruments, and certainly we're having different people take it. And even if we're trained, what happens is our training tends to wane, and unless we repeat it, we tend to get in all kinds of problems. When we've observed how blood pressure is measured in office settings, only about 1 in 25 is measured according to a recommended protocol. So only about 4% of the time in clinical settings is blood pressure measured the way we recommend it to be measured. And that does lead to some problems. And so Dr. Kaplan, who's dedicated his entire career to high blood pressure, says it's perhaps a procedure of great importance that's performed in kind of a sloppy way. This is a study where the blood pressures were taken in patients with high blood pressure, 50 people with high blood pressure. Let me walk you through this, because this tells us the kind of impact a device like this can have. So that first blood pressure you see there is the average of these 50 people with high blood pressure, 162/85. This was taken using a machine similar to this with staff in the room. So you put on the cuff, you sit them there, you get them properly positioned, you take the blood pressure. Then the staff walked out of the room, and the patient was alone in the exam room. And you see what happened to the blood pressure. It came down quite a bit. And so that's what this device allows you to do. Make sure the patient's properly positioned, seated, back supported, feet on the floor, arms supported at heart level. Make sure the cuff is working. Make sure you get the first blood pressure. And then we'll show you how to use it. You can then reset it to take 3 pressures, not 5, but 3. And the machine will average those 3. And what we've learned is the average of those blood pressures after we're out of the room is much more representative of the individual's average daytime blood pressure. And that's really what we're interested in. What's their blood pressure on average outside the office during the day? And this number is a lot more closely related to that than the first blood pressure we take with us in the room. Okay? This is a study that, just to say that a lot of people whose blood pressure is not controlled have what we call office resistance. If we do a blood pressure that gets a more representative blood pressure at their usual daytime, we'd see that many of them really don't have a blood pressure that necessarily requires more treatment. Now some might say, well, isn't that office blood pressure important? Yeah, it has some importance. The problem we get into is that the office blood pressure is high and the out-of-office blood pressure is not. We keep giving more medication. We make people sick with too much medicine. Their blood pressures go too low outside the office. They're getting dizzy. They're getting lightheaded. They could be passing out. They could be feeling kind of poorly because we got their blood pressure too low. And this is said about 40% of the time in people with bad high blood pressure on 3 or more meds. The blood pressure outside the office was okay. It was the blood pressure in the office that was high. And so what we have here today is a device, you'll be getting those, and the Palmetto Primary Care already has a number of these devices. It'll do a few things for you. It'll take blood pressures in both arms. Now we're not going to recommend necessarily that you do that routinely, but you can. And particularly older individuals, very high blood pressure, if they've got if they've got heart disease, if they've got bad circulation in the legs, sometimes it's a really good idea to take it in both arms because sometimes they have a blockage in the artery on one side that'll make the blood pressure much lower. And so this device will measure blood pressure in both arms at the same time, which is kind of a hard thing to do using the same technology. If they're more than 15 millimeters different, that's a good clue that that person has, kind of bad vessels that are plugged. And so that can be a useful thing. What we're going to recommend for the most part, though, because most of your people with high blood pressure don't have that severe vascular disease, that you just use the follow-up mode rather than the first visit mode. And that is programmed to take 3 blood pressures. We'll have you take 1 and then reset. And Shannon will go over this with you. And then after the 3 readings, when you're out of the room, you can come back and it will give you the average systolic, the average diastolic, the average heart rate. And those are the numbers we want you to write down and put in there. This just basically says when they compare this monitor to daytime ambulatory blood pressure, where people wear a blood pressure monitor that takes their blood pressure like every 15 minutes, the blood pressures with this device correlated pretty strongly with an R value of 0.8, which is a pretty high R value. It means they're pretty tightly correlated between the awake blood pressure when they were wearing a monitor and walking around and doing their usual things, and when this device was used. So what does this device do? It'll give you 3 automated readings while you're out of the room. It will average those. Those average blood pressures correlate very strongly with daytime blood pressures if people were wearing a monitor and have their blood pressure measured every 15 minutes and you took that average. And that correlation is much better than the usual office blood pressure, the way we take it with us in the room and with a patient. We can do both arms in people that we think have bad vascular disease if we want to try to detect if maybe they've got a blockage in the artery on one side, because it could be 140 on one side and 180 on the other. Probably be useful for us to know that, okay? And then we'll not talk about this today, but this monitor can also detect irregular heartbeats. One called atrial fibrillation increases the risk of stroke like 15 times. And so it's very useful for us to know if our patient has atrial fibrillation because there's treatment we can give them to greatly reduce their risk of stroke. Again, we're going to focus today on the blood pressure measurement. Maybe we'll do another training and talk about that. We'll give you the manuals too to look at that. So again, these people are at very high risk, I think more than 5-fold increased risk, because they form clots in the upper chambers of the heart that sometimes then break off and travel to the brain, and that's really, really bad. It contributes to quite a few of the strokes, and we can do a lot to reduce that. And a lot of these people are not aware of their condition, so you have an opportunity to pick it up. It increases with age, so that by the time you get up around your 80s, 15% or more of people have this. So again, it's more common in the elderly. They do have irregular heart rates. And it's a common problem. This shows the ability of this device. What it says is pretty darn good at picking up atrial fibrillation. So when we get to that part, it's really this device will pick it up with If people have it, there's almost 100% probability this machine will detect it. Now, when the machine says they have it, about 90% of the time they really do. That's called the specificity, but in this case, the sensitivity, if they have it, almost always this machine will detect it, okay? So this is where we started. We want to get a blood pressure that's both accurate and representative of the usual daytime blood pressure for that patient. That way we can give them, make sure we're trying to give them more appropriate treatment, not over-treating them or under-treating them. It correlates very strongly with the average daytime readings. If you're concerned about bad vascular disease, it can measure blood pressure in both arms at the same time. And it can also detect this irregular heartbeat called atrial fibrillation that puts people at very high risk for stroke. So I'm going to stop here. And if there are any questions, Shannon and I would be happy to try to answer those. Okay. And please don't be shy at all. If you have a question, just be bold. Go ahead and tell us you have a question. And it's okay if it's a really hard question we can't answer it. That's okay too. That's right? Because together we'll find the answer. Okay. But I think you know why we think this is so important. Now the other thing that will be important with this is you realize that if you're taking the blood pressure in the room and you're leaving the room for a few minutes while this device, it's important to have other things you do so you're not wasting or losing time, because we know you're all busy. And being able to use this device without losing time so you can keep patients flowing through your clinic is going to be really important. Dr. Lakin, who worked with Dr. Hudson, and I have gone to many clinics and talked about that exact issue. And after talking it through for 20 to 30 minutes, almost every clinic can come up with a way that there's something important to do while you're out of the room so it doesn't really disrupt the patient flow. But that's going to be very important because you've got a lot of people you need to see every day. And we can't be trying to do this and prolong your workday either. We have to fit this in within the workday. So that's going to be very important. Comments? Questions? Yes.
Does it, is it made for pediatric patients as well as adults?
Yes. Shannon may talk, but yeah, these devices have been used in children also. And Shannon, you work with children a lot.
I do. I'm a peds nurse. I'm back at PICU. But what you're getting right now, there's no peds cuffs with it. I mean, if it's an adolescent, then you want to have the appropriate cuff size. But I read in here that you can order extra cuffs.
You can. So. You can. And devices like this have been used maybe more recently, more like in 3-year-olds and older. But the technology that's used should work below that, but I know that this type of device has been validated down to the age of 3 and shown to be accurate.
Well, I can add a bit of humor. I was practicing last night to make sure I knew how to use it for you all. I have a 10-year-old, an 8-year-old, and 2-year-old at home, and all 3 of them insisted on having their blood pressures taken.
Very good.
Wrong size cuff, but they were fascinated. And the 2-year-old laughed every time it inflated to make a whirring sound. So children are fascinated by the machine. I have evidence.
Well, very good. And obviously, we want to be able to measure blood pressure in kids as well. If they've got a problem, do something about it. So that's important. And I know a lot of you see pediatric patients also. And more of them are having blood pressure problems because they're living too much like we are, and their blood pressures are going up. So like Shannon said, a lot of them actually, this regular adult cuff will fit because their arms are already getting kind of big. The problem with a cuff that's too large is it may give you an artificially low blood pressure. Like a cuff that's too small can give you an artificially high blood pressure. So it is important to try to get the cuff the right size, and we can talk a little bit about that when we get into the measurement. Any other questions for us? Okay. Well, Shannon, maybe I'll go ahead and turn it over to you, and I think you probably also invite questions also.
Sure, yeah, absolutely. And I think we're going to do a demonstration
we are.
Too.
Yeah.
And we were talking earlier, it's hard for me to read this book and understand how the machine works. I have to get my hands on it and try things out and push the buttons. And Dr. Egan was speaking to the importance of, psychomotor learning. So we probably won't spend a whole lot of time talking to you about it. I prefer to have more time to interact and, maybe help you through some of the steps if you're having a little bit of trouble with it.
Yeah, we do have, several monitors here today, so you can practice to get that hands-on. We thought before lunch, though, that we'd just sort of walk you through so you have an idea of how to use the machine, okay? So we have one up front here, and Shannon, maybe we can just talk through it together with them.
Okay, sure.
Yeah, in your...
Well, Kim volunteered to have her blood pressure taken.
Have to have a large cup.
Okay, well, we can accommodate that, absolutely. So the usual cup here says it's arms that are 8.7 to 12.6 inches. And a lot of the people we see have arms that are bigger than that. In fact, I would say probably well over half of the people we see, adults with high blood pressure, will have an arm bigger than this usual adult does. So we'll go ahead and plug that in and set up the measure on the right side. Oh, Kim, if I could, maybe have you sit at the table, we just pull up this chair alongside, so you could rest your arm on the table, so we try to demonstrate this. Should let me have you come through so I don't block you out.
Sure.
Okay. Kim, you want to give me your jacket? I'll put that on the back. Larry?
I was just reading this morning too, that these cups that come with this machine have a range index to help you judge whether the cup's the appropriate size or not. So when you wrap it around the arm, the end of the cup should fall within this range index if you have the appropriately sized cup, which I think is helpful.
It is. So if you're in doubt, just go ahead and check those lines. If it fits within the lines, you're good.
All right. Well, say on the right arm, but I'm measuring the left arm, so I'm going to have to change which,
You are.
which arm.
Yes.
This one.
So you'll get a demonstration of this device, unless you tell it which arm, it's going to blow out of whatever arm or both arms. You only want it blowing out of the arm you want to inflate. So and it'll blow air everywhere.
I tried that a few times, right? First visit mode does both arms. Follow-up visit mode does a single arm.
That looks like Kim's right arm.
That's one.
Oh, I know your right arm. Okay,
Yeah.
so we're set for the right arm.
You are.
I haven't changed the
Yeah, we should. I messed it up. I was thinking of Shannon.
That's okay. The on-off button is on the back. There's also a Bluetooth mechanism for this device. We're not incorporating that right now
Not
in the
right now.
training.
Mhm.
So you want to make sure the Bluetooth is off. That's this bottom switch down here. And then this is the on-off switch right here. Okay, so we're on, and then this is our first screen. If you need to change the side that the cup is going on to, which side you're measuring, then you press and hold the M button. And we have posters that we're going to give you.
So the M button is on the bottom left.
Mhm.
Okay.
And now, I don't know if you can see this or not, but the right is blinking. So if you need to change to the left, you just push, oops, wrong one. Push the M button again.
Mhm.
Okay, so we're doing the right arm, and then push on off, which is the other button down here, to set it. And we were just saying that we are going to change the inflation pressure, so for that, you hold the on off button. You hold it for 3 seconds, the time interval starts flashing, keep holding it a little bit longer, and then the inflation pressure starts flashing. And then you can change the inflation pressure.
So the time interval is how long it waits between blood pressure from the finish of one to the start of the next. And you can adjust that 15, 30, 45, and 60 seconds. You've got it set at 30.
Okay, and when you get it where you want it, I'm going to set it to 200, you push the on-off button again. And now it's set, and we're ready.
Now for the inflation pressure, you go 140 to 280 in 20 millimeter increments. So once you get that up there, you just tap that button and it'll go up to 20 and it'll go from 280 back to 140 when you start over.
Well, so we want to have your arms exposed as we can, but we don't want it to be restricted in any way.
Okay.
So if it's restricting your arms, it's probably better to pull it down,
Okay.
do you think?
Yeah, I mean the preferred way, and the problem we get into the winter, people are going to have long sleeves like I do, right? And so what we prefer to do is to have the cup just on the arm. That would be always preferred, and certainly not over a sweater or a jacket. That really messes things up. But ideally, we have it on the bare arm. So I've interrupted, but go ahead, Shannon.
No, that's helpful to me, because I mean, you're the hypertension expert, so I want to make sure I'm telling you the right thing.
Yeah.
I've read it all.
Right.
I said you don't want the arm to be constricted in any way, and I was afraid by pulling her sleeve up, it was going to be too tight around the upper arm.
It could be, absolutely.
Okay.
And we're not going to take Kim's blouse off today.
All right. mark. You want to try to place that over the brachial artery.
If I may just interrupt for a moment here. So in terms of the brachial artery, you can either feel it, sometimes that's challenging, but the brachial artery is in a pretty predictable location. If you feel the biceps tendon here, it's going to be medial to the biceps tendon. So if you feel the biceps tendon and go over about 1 or 2 centimeters, you're going to be very close to where the brachial artery is, okay? So it's toward the body from the biceps tendon, and that's where your brachial artery will be.
Okay. And I want to check and make sure it's snug, but I can still slide a couple of fingers under there. And it's about an inch away from her antecubital area. So far, so good?
Yeah, so about an inch above the bend of the arm, okay? Uh-huh.
I figured, nurses start a lot of IVs, so they know all about the antecubital area.
They do, absolutely.
Okay, so ma'am, I'm going to take your blood pressure now. You have your back supported. Yes, you do. Okay, your arms about heart level. Your feet are flat on the floor. Do you have your cell phone off?
Yes, ma'am.
Okay, I would like for you not to talk while your blood pressure is being measured, please. Yes. Okay. So I'll take the first pressure, and you just press the on-off button. Now it's going to have a 30-minute pause before the first pressure. We're all busy and in a hurry, so if you want to skip that first pause while you're in the room, just push on-off again, and it'll go ahead and start taking the pressure. Just gonna get a little tight. Okay, so we have our first reading. Now, the machine's set in follow-up mode, so it's going to start counting down for the second reading. But what we're recommending you do is record this first measurement. And you need to record it before you cancel it out, otherwise it's going to go away. So you record the first measurement, and then you reset it. So you push the on-off again to stop. So I just canceled it. I canceled those second 2 readings of the series of 3. And now I want to restart it and do 3 readings while I'm out of the room, okay? Okay, ma'am, I'm going to take your blood pressure 3 more times while I'm out of the room. There's going to be a pause in between each blood pressure. I ask that you stay where you are, just be kind of comfortable, but don't get your cell phone out, please don't talk. Okay, I started the countdown. I'll hold it up so you can see it counts down. And after it takes this first blood pressure, it'll say down here what number it's on. 1, 2, 3.
Very good. That's basically what it is. So you're out of the room, it will count down as 30 seconds, take a reading. When it's finished, it'll do 30 seconds and count down again, take a reading, 30 seconds, count down.
When it gets towards the end of the 30 seconds, it starts beeping.
Yeah, the last 5 seconds.
I have a question. To get all those, you said that the first one, the first reading, you have to record because you'll lose it when you do the on-off again. What about the other 2 or the other 3?
The other 3, you're going to get an average at the end of the 3 readings,
Oh, it's
and it'll
average,
say at the
that's
bottom
right.
A.
Right.
But then you can go back and see what the 3 were. And I can show you how to do that after we get Kim's 3 readings. So you can go back and look and see what, was there one that was especially higher than the others that you might need to throw out. So certainly I'll show you how to do that. And when you get the first reading, these machines are preset to a 60-second interval and an inflation pressure of 180 millimeters mercury. So when you get the first pressure, if you notice the patient's systolic blood pressure is around 170, you probably are going to need to change the inflation pressure to what would you recommend, 200, 220?
You know, we'd recommend you take it up. What you'd like to do is get it a good 20 millimeters above the pressure, so if you raised it to 200, the next one's 192, take it up again, okay?
And I think we're also recommending 30-second interval, because we are, you know, sensitive to how much time you guys have.
Yes. And we think 30 seconds is plenty to wait between measurements.
I think it does, 15-second increments that are your choices, so it's 15, 30, 45, 60, is that
Correct.
right?
Mhm. The good news is, once you reset it, it'll keep your setting. So if you want to, once you reset to 30, you don't have to do that for every patient. It will, even though the default is 60, it will keep that 30-second interval in place. Similarly with the cuff inflation, if the default's 180, but if you set it to 220, it'll hold that in its memory. 200, whatever you set.
Okay, that was number 2. One more.
It's a very polite monitor. It gives you a little warning before it clicks the cuff.
Okay. Thank you, ma'am. Okay, so it shows, oh, it's not done. Did I miscount something? I know it was the third. Maybe we had an error in there. This is doing a third again.